Derya Unutmaz is a human immunologist at Jackson Laboratory, a non-profit medical research institution, and he joins me now live from Connecticut in the US with more on the blood plasma treatment. Great to have you on the show. Thank you for making time for us.
Thank you.
How hopeful are you that this treatment using plasma can actually work?
So we're actually quite hopeful. This is a very important treatment option. We don't yet know whether it's going to work or not. But as you previously mentioned, the principle is that the healthy individuals or those who have been infected with coronavirus and who have recovered generate what we call antibodies in their body. This is a part of a defense mechanism of the immune system. And basically, the principle is sort of like a smart missile, if you like. These antibodies go and bind to the key on the surface of the virus and prevents the virus from entering into the cell. Therefore, the virus cannot replicate and make its own copies. So that's a very important mechanism that those who have healed prevent reinfection. This is also partly a basis of vaccines. So you need to generate these antibodies to protect yourself.
Okay.
So the idea is
I need to just jump in to ask you, when could this be available? Because it sounds fantastic, but when?
Sure. So in a number of countries, including US, FDA have just approved the use of this in sort of a clinical trial as well as an emergency treatment protocol for severe patients, those who are in ICUs, who have no other option. There's, of course, a certain protocol that the blood has to be taken from a person who has recovered. At least a 2-week period has to pass from their symptoms, and they need to be negative for the virus but positive for these antibodies. And the blood is taken from them and then given to this patient with COVID-19. The trials have just started, and we will know how effectively this will work in the next few weeks. And I'm sure also in England and other places, people are trying this, including in Turkey, actually.
Okay, so in the next few weeks, we'll know how successful it's been. And in the past, how successful was it? Not with, obviously, COVID-19, but with other viruses?
Yeah, this is actually a very old technique. It has been used for decades, maybe even more. So the idea is not new. It has been tried in different infections. I think in H1N1 infection, the influenza epidemic. It's the effectiveness have been variable. I wouldn't say it's a miracle treatment. But certainly some patients have benefited. And then in COVID-19, there's actually reports from China where they've done small studies where some of patients really improved when they were in pretty bad shape. So we are hopeful, but we have to wait for the trials to end and see how this will end up. It may not help every patient. We also don't know when to give this plasma. But there's a very good principle or hypothesis why it should work.
Mm-hmm. So you don't know exactly when to give it in the time frame when the person is ill. But tell me, are people coming forward? Is it easy to find donors right now?
I would imagine so. I mean, this is really a war, and so people are really volunteering. And trying to help save lives. So I would imagine that there's not going to be any problem finding donors. And there's really no harm to the donors. It's like donating blood, basically. Nothing more special.
Derya Unutmaz, it's been a pleasure speaking to you on TRT World's NewsHour. Thank you.